You are welcome to my channel. Today I'll be talking about ischemic stroke syndrome. I have published a separate presentation on subtypes of stroke, that is, ischemic constituting about 80% of all strokes and hemorrhagic about 20%. Also on my channel you can check for lacunar stroke, causes of stroke, the symptoms, treatment and prevention, all already published. I will start with anterior cerebral artery, and that will be supplying the parietal lobe, both the superior and middle parts, and also supplying the frontal lobe and the midline. Anterior cerebral artery will not usually cause stroke because it's an uncommon cause of stroke. And when it occurs, it's just in about 1 to 3% of all cases of stroke. In those people that will come down with stroke because of anterior cerebral artery occlusion, they will have deficits more at the legs than the face or the arm. And there will be contralateral weakness that will be greater in the legs than arms, and there will be bilateral changes. Also, there will be impaired judgment, and primitive reflexes like grasping and sucking will be present. They will also have motor deficit, or sometimes they have only the sensory deficit, but in some, they can have both the motor and sensory deficits. Still talking about anterior cerebral artery occlusion, that could lead to altered mental status, incontinency, contralateral hemiplegia, limb dysplasia, transcortical motor aphasia, or sensory aphasia, which means they will have contralateral cortical sensory deficits. They can have disinhibition, which means they will have socially inappropriate behavior. Remember, I said earlier that it will affect behavioral changes. They can have abulia, that is neurohypofunction, or they will lack the drive, or they will lack self-initiative. They can have paratonic rigidity, that is the inability to relax the muscles during muscle tone assessment. And gait apraxia is likely to be present because they will have difficulty getting started with walking, and they even have magnetic or shuffling gait. The gait apraxia is commonly seen in people with dementia, particularly vascular dementia, and in normal pressure hydrocephalus. But in anterior cerebral artery, we can get that. And they will have speech perseveration. Now, if the anterior cerebral artery occlusion is at the distal part of the artery alone, then there will be contralateral weakness of the leg, the hip, the foot, and the shoulder. And then there will be sensory loss at the foot. The middle cerebral artery. This will supply a large area of the brain, and that will include a portion of the frontal lobe, the internal capsule, the temporal lobe, and the parietal lobe. When there is middle cerebral artery stroke or occlusion, that will be associated with headaches, difficulty speaking, facial droop, weakness on one side of the body, and numbness on one side of the body. The occlusion of middle cerebral artery could occur at the dominant hemisphere or the non-dominant hemisphere. If it's occurring at the dominant hemisphere, there will be global aphasia. dysarthria, and dysphagia. There will be complete hemiplegia if the internal capsule is involved. Contralateral gaze palsy with hemisensory loss hemianesthesia or homonymous hemianosia will all likely be present. Still, if it is occurring at the dominant hemisphere, there's likelihood of spatial neglect, that is extinction and inattention, the newer definition, right? Motor and sensory deficits will be greater in the face and arm more than the leg. Remember, arterial cerebral artery will have that greater at the legs more than the face and the arm. The motor and sensory deficits in the legs will be greater than in the feet, and there could be coma. If the occlusion of middle cerebral artery is occurring in non-dominant hemisphere, there will be hemi neglect or extinction or inattention, and also nausea. That is, the individual can't perceive his or her own mental condition accurately. In other words, they lack insight. Homonymous hemianopsia, that is partial blindness, motor and sensory deficits, that will be more on the face and arm, more than the legs, and more in the leg than default. Contralateral gaze palsy or weakness, and of course hemiplegia. The posterior cerebral artery will be supplying occipital lobe, brainstem, that is the midbrain, the pons and medulla oblongata, inferior part of the temporal lobe, posterior limb of the internal capsule, and also supplying thalamus and cerebellum. When there's occlusion, ischemia of posterior cerebral artery, the presentation will include headache at the back of the head. Needless to say, right? Posterior. Associated with nausea and vomiting, and acute visual problem. For example, loss or double vision, and of course nystagmus. There will be associated confusion, memory loss, vertigo, and dysarthria. Still on posterior cerebral artery stroke, there will be alexia. That is inability to read or inability to recognize words, particularly in someone who could read and write before, right? And also paresthesia, that is numbness or tingling, visual perseverations, particularly if cranial cortex is involved, and of course visual hallucination. Once you hear the word posterior cerebral artery, think about visual problems. Still about posterior cerebral artery stroke, there could be chorioathetosis, homonymous hemianopsia, spontaneous pain if it is affecting the thalamus, and vertical eye movement paralysis. There could be motor deficit, particularly affecting the cerebral, peduncle, or midbrain, sensory loss, limb and gait ataxia, Weber syndrome, that is cranial nerve 3 or oculomotor nerve palsy, and of course imbalance. Now, vertebral basilar or VTB. This will supply the spinal cord, particularly the cervical region of the spinal cord, also supplying the brainstem, the cerebellum, the thalamus, and occipital lobes. Here, anyone with vertebral basilar stroke will have lock-in syndrome, particularly if it is proximal and middle occlusion, but tegmentum is not affected. There will be lock-in syndrome. There's a full presentation on lock-in syndrome here on my channel. Please check that out. Still on vertebral basilar stroke, having motor deficit, limb ataxia, gait ataxia, diplopia, or dizziness. From distal occlusion, we can have top of the basilar syndrome, meaning the upper brainstem and thalamus ischemia. And in that case, the individual will have altered consciousness, oculomotor disturbances, pupillary disturbances, and visual hallucination. Bilateral signs, that is, basilar artery disease, could occur, also dysarthria, dysphagia, hiccup, cranial nerve pulses, and cross-sensory deficits. There may be nausea and vomiting, and coma. Now, internal carotid artery. There will be progressive middle cerebral artery syndrome or stunting, that is, stunting onset of middle cerebral artery syndrome, something that is not so quick and fast, so gradually forming, sort of, okay? And sometimes anterior cerebral artery syndrome will also occur if there's insufficient collateral flow. The penetrating arteries or lacunar infarct will be another topic entirely. You can check my channel here for full presentation on lacunar stroke. So I'll not waste your time going into that. With that, I've come to the end of this very presentation as per ischemic syndrome. Remember to share this with your friends. Remember to subscribe to my channel. I appreciate it.